my name is Robert Harrington, and this is my older adult assessment for Texas Tech University of Health Sciences. Now, can you state to me your name, please?
Bobby Fisher,
Bobby Fisher, and when's your birthday?
October 24th, 1938.
Okay, how old are you?
80,
Okay, what city do you live in?
Neyland,
Okay, and who's our president?
President Trump.
Okay. Okay, well, first things first, I'm going to test your hearing. Do you have any hearing problems?
None of I know of.
Okay. Well, I'm going to do a whisper test. So what I'm going to do is I'm going to go over each ear and whisper something to your ear, and you're going to repeat it back to me. Okay?
Okay. Red brick,
Okay.
train track,
Okay, good. The second thing I'm going to do is I'm going to evaluate the breathing of your nostrils. So I need you to hold down one nostril and breathe in and out. Okay, now do the other one. Okay. Now next thing I'm going to do is I'm going to test your ocular motor skills. So I'm going to hold this pin up and I'm going to have you follow it with your eyes in each direction I bring it, okay?
okay,
Okay. Next thing I'm going to do is I'm going to palpate your lymph nodes. Okay, I don't notice any swelling. Now, the next thing I'm going to do is I'm going to listen to your heart and lung sounds. So first thing I'm going to do is I'm going to listen to your heart sounds, and then I'm going to listen to your lung sounds. When I do that, I'm going to ask you to take deep breaths from me. For the purpose of this video, we're going to do everything over your clothes. Okay, I'm going to listen to your heart now. Okay, now I'm going to listen to your lungs, and each time I'm going to have you have a deep breath, okay? Okay, can you lean forward for me? Okay, your lung sounds are clear bilaterally, so that's good. Okay, next thing I'm going to do is I'm going to test your muscle strength. So I'm going to press against your head, and you're going to push against it, okay?
okay,
Okay. Okay. Now, with your shoulders, I'm going to have you do the same thing. Push as hard as you can. Okay. Now I'm going to have you tilt your head down and push against it. Okay, same thing behind. As hard as you can. Okay. Now may I see your hands, please? Okay, I'm gonna have you squeeze them. Okay. Now push against them. Oh, pretty strong there. Now I'm going to test your leg resistance, so straighten out your legs. I'll put them together. Okay. Push against my hands with your knees. Okay. Now with your toes, do the same thing. Okay, now push against this way with this leg. Same thing with over here. Now do the opposite. Well, I like to think that your muscle strength's pretty good. Okay, next thing we're going to do is we're going to test the Tinetti assessment. Now normally that takes about 10 to 15 minutes, but for the purpose of this video, we're going to shorten it. So with that being said, can you stand up for me, please? Okay. Now, what I need you to do is close your eyes and have your arms spread out like this for 6 seconds. Okay, you can open them. Now I'm going to do the nudge test. So I'm going to lightly tap against your chest and test your balance. So I'm going to tap your chest 3 times. Okay. Now stand forward for me, please. I'm going to need you to turn one circle 360 degrees. Okay, very good. Now, can I get you to sit back down for me, please? Okay, very good. Now, the next thing I'm going to have you do is I'm going to have you walk 10 steps that direction and back. Okay, you may sit back down. Now, Mr. Fisher, I see that this is your home. Do you have any loose power cords anywhere?
No.
Okay. I also noticed that you have some floor mats. So with that being said, can't tell you what to do with them, but I would suggest either getting rid of them or having them fastened down to where you don't trip on them because they are a safety hazard. I also noticed that you do have stairs, so I would advise caution when going up and down the stairs. Be sure to wear shoes every single time you go up down the stairs and use the handrail at all times. Do you have any pets?
Yes.
Okay. Well, what kind of pets do you have?
2 dogs.
2 dogs? Okay, well, once again, I'll advise you just to be cautious when around them. They like to get in between your legs and all that, and that is a fall risk, and I don't want you injuring yourself. Now, do you have any medications?
Yes.
Okay, and are they locked away safely?
Yes.
Okay. And do you have any grandkids?
Yes.
Okay, and the medication can be kept safely away from them?
Yes.
Okay. And finally, do you have insurance?
Yes.
Okay, well, I would advise you just to check with them and see if there's any means for you to reduce your rates. See if they can work with you to have a better coverage for you to where you don't have to spend so much for your medication. And that's just about it. It's my presentation. Thank you very much.